All right. Good afternoon, everybody. Thank you all for joining a brief webinar this afternoon, discussion on the OSMA health plan. We are joined today with Brandon Embry from the Commonwealth Insurance Partners. Uh, they are a group that helps various industry partners for design and set up health plans for their employees. So he's with the Commonwealth Insurance Partners, and then the Oklahoma State Medical Association is a health plan that we're going to talk about today. And this is a plan that the Kentucky Pharmacists Association has looked at and is happy to endorse. And we work with Brandon and his team to offer that to Kentucky pharmacists and their teams. So with that, I'll turn it over to Brandon for a further introduction if you'd like, Brandon, and then you can talk a little bit about the plan.
Yeah, appreciate it, Ben. Again, want to thank the KPhA and Ben and Clay for having me this afternoon. And I'll take a few minutes just to, again, he kind of gave me a quick introduction, but kind of who we are and what we do and who we represent. And again, we're with Commonwealth Insurance Partners, and in a traditional sense, we are an advisor, broker, agent, however you want to refer to us, to help employers set up, health plans on a employer level, or potentially even individual or Medicare, or help, talk about Medicaid as well, even though we don't do a lot with Medicaid. So it's probably, a little bit different, with talking to an insurance agent than what you're accustomed in doing, but we represent several different trade associations, whether it's the Kentucky Association of Manufacturers, the Architects and Engineers, and then most recently, your all's organization with the KPhA. So, we try to be a point of contact. Obviously, the insurance companies, give a lot of problems or cause a lot of problems, struggles financially, time-wise when it comes to your industry. But we try to do things a little bit differently when we can create transparency on a health insurance plan when it becomes available, or try to set up certain direct hospital contracts or direct primary care contracts. So we're trying to do our best on our side of things to bring things to surface, more transparency that I know you all want, we want on our side of things as well. It's never good when we're, giving a 15% increase to a group and there's no reason behind it. So our goal on our end as an agency, and I think that we'll be on your side more than other insurance advisors, brokers, that quite frankly don't know or understand your struggles, and where this kind of came out, or how this became into existence, is really my relationship with a few independent pharmacists over the last 10 years. And one of them, I believe, is on the call, where I would ask questions or he would give me examples of basically reimbursement rates not even covering your acquisition cost, and having those conversations of how the insurance side of things is really affecting you all. Now, I'm not here today to give all those solutions, but I wanted to give a little background of our relationship and my point of view of, I was hearing about Senate Bill 50, before it became into existence, when it came to the Medicaid program. I've heard him and others talk about how DNR fees were affecting their business, and hopefully, luckily that's gone away, but how it was really hurting you all financially. Medicare Part D plans, certain contracts that you all had to make business decisions to get out of. So we were hearing a lot of that, and I continue to hear a lot of that with talking to independent pharmacists. GLP-1s has been a big talking point that you all are well aware of, but I just want you all to understand that on our side of things, that we are trying to represent you all as best as we can, but also try to come up with solutions to provide financial benefits. And the OSMA health plan is kind of what we've kind of put in front of Ben and KPhA, as far as hopefully trying to save some monies, or at minimum give you another option that isn't just Anthem or United Healthcare. And this has been good for independent pharmacists. We've signed up several throughout the state of Kentucky that came from a different environment, whether it be, again, Anthem or United Healthcare. So we presented this to some about a year and a half ago, and it turned out well financially. Now, I will say that it doesn't work out every time, but at minimum, for small groups like yourself, having another option that doesn't dilute the benefits that you're providing to your employees, or if you don't offer anything now and you've been thinking about it due to retention, this has been another plan that we can put in front of you all that potentially could be a solution. And there's some uniqueness about this that I'll get into, but I just wanted to, take a few minutes just to explain where we're coming from and kind of what we've done thus far in the last year and a half. And, again, I do not have any solutions when it comes to how to solve the GLP-1 problems, the Part D contracts, and getting out of Express Scripts or staying with Express Scripts. But we want to make sure that we're staying up to date and educated on your business and making sure that we understand where you're coming from. So with that being said, I'll get into the health plan. So again, Ben talked about this is called the OSMA health plan. The OSMA health plan was put together back in 2005. It was put together by healthcare professionals, physicians, primary care, dentists. They all came together and said, hey, we need to do something different than what we're doing today. So what they did is develop this health insurance plan, obviously in Oklahoma. Then it went to Texas, went to Arizona, went to Arkansas, and then it came to Kentucky back in January of 2023. So to be eligible for this health insurance plan, you have to be obviously in the healthcare industry in some capacity. So this plan is eligible to the majority or all the industries that you see listed there. And there's some other ones as well that would be eligible, like durable medical equipment companies that are not listed on here, but they would be eligible to be a part of this. Now, about the health plan and kind of the nuts and bolts of it, it does tap into the United Healthcare Choice Plus network, which that's their national network. So if I'm in Paducah, I'm having access to Mercy or Baptist, or if I need to go to Vanderbilt, it's giving me those access points when it comes to the providers, hospitals, contracts. If I needed to go to the Mayo Clinic, I could go there. Now, what's different about this plan versus again, traditional health insurance United plan is it's not using OptumRx as the PBM. It's using a PBM called Veris RX. With Veris, when something comes up throughout the year, you and your employees potentially will have access to manufacturing assistance programs if their incomes meet a certain level. you could tap into IPP, the International Pharmacy, or, certain discount cards to help offset the claims that would be incurring with, filling that Stelara. That's, obviously Stelara is a specialty medication. If it was with United, they're telling us that it's a $10,000 a month medication, but they do not disclose what the rebates that they're getting from the health plan. And I do want to make sure everybody knows that any rebate that Veris receives goes back to the health plan. So if we did have someone that was in that category, an employee that or spouse that starts taking a specialty medication, we do have options to potentially source that medication differently. Where if you were with Anthem or United Healthcare right now on the traditional plans, we know that they're likely gonna keep it on the formulary. They're gonna, dispense that medication, receive a rebate, but not tell you all, or it won't go back to the health plan. So having Veris RX is going to be the biggest uniqueness to this plan. It's going to allow us to have some alternate options when we do have that one employee take that high cost medication, so it doesn't, impact the health insurance plan so drastically, and we're able to at least give a alternate option. Now we can't make any employee do that, but it again allows them to have access. And with United Healthcare on the traditional model, they would not allow us to do anything like that. So it's another possibility that we can tap into that gives the health plan a better option long term. A couple other things you'll see on the next slide, kind of all the plans that we offer with OSMA, but all the copays are the same, whether it's primary care, specialty, or urgent care. So you'll see, a $35 copay for primary care. It's going to be the same for a specialist, urgent care, etc. One other thing or a couple other things about this plan. Now, I don't know if you would ever do this, but if you needed a hernia surgery, in theory, you could go to the Surgery Center of Oklahoma, which if you look them up, they're actually one of the few out there that will give you a rate from door to leaving of what the cost would be to get that hernia surgery done. But in theory, if you wanted to have that surgery done there or any of the other listed facilities, that you could get that done for $0 cost. So they're trying to direct that because there's quality metrics with those three systems that they get, whether it's through Quantros or CMS data, that they're trying to steer people into higher quality providers. So that would be a uniqueness to this plan. But again, obviously we're in Kentucky. Those places are in Texas and Oklahoma, but that would be something that you could look into when we have those one-off situations. Another thing to try to keep costs down, going to Quest Diagnostic facilities instead of LabCorp. You can get your blood work done at $0 if you use, again, Quest Diagnostics. So moving on to the actual plans. So we have 5 different plans that we offer. The first 3 columns that you'll see, and I'm not going to go through every one of these individually, but those are going to be what we would consider your traditional copay plans or PPO plans. One's $1,000 deductible, one's $2,000, the other one's $4,000. And you'll see the max out of pockets on them, and then the copays for each service that is getting done. The other two plans are what we considered high deductible health plans. So HSA compliant plans, where in theory you could put money away into a tax-free HSA on an individual basis. It'd be $4,300 for 2025 and $8,550 for a family plan. You obviously a little bit higher deductibles, but it would allow you to, again, tap into those HSA dollars if that is something that you're doing today or have heard about, but didn't know how that actually works. Questions about the kind of how we go about to get quotes together. If I have an employee count that is more than 10 employees, so if I employ more than 10 or I have 10 employees that are interested in the health insurance plan, we can use a census enrollment or census quote. Now, if I'm under 10 employees, so 2 to 9, it does require health applications or questionnaires. It's a pretty basic questionnaire where they just say what medications do you take, what has happened in the last 5 years, and they will underwrite the group and give us a rate because they are still individually underwriting the group or your groups specifically as a whole. This is a association plan, so it's a large group that they don't want to just you're not going to get every group that is benefiting from this, but because they don't want to dilute the risk, but it has been very beneficial for a lot of groups, but they don't want to again put in bad groups or let's say unhealthier groups into a pool that could cause rates to go up down the road. So they do underwrite every group individually, and those are the requirements if I have more than 10 or if I've got employees that are 2 to 9. Now, I always say it's better to get applications even if you have 15 on the plan currently, because usually there's something within the application that they are pulling from AI pharmacy tools called Gradient or Verify are the two that they pull from. So they're just pulling big pharmacy data and trying to project what claims would be based on what you're picking up. And what they're pulling could be out of date. So it's always good to get applications if you can, and go from there. You do have to join the OSMA if it got to a point where the insurance rates make sense for you and your employees. And it's a $250 once a year fee to be a part of that. And that talks about the fees right there, $250. And then this kind of gives you a breakdown kind of again once we get to the point of wanting to sell the group or go with OSMA of what is needed. So it's pretty basic stuff. And then as a member, you do get a portal. And one thing I didn't mention, and you're probably seeing the ABA or Assured Benefit Administrators. They are the TPA that does all the claims adjudication. They do the billing and enrollment, any eligibility changes. They're the one kind of handling all that for us, but they give you a portal as a consumer to check your, what deductible have I met? What max out of pocket? I need a temporary card because I lost it. So it's giving you that information and you would have access to a portal with them. All right. I know I've talked for quite a bit. We're trying to keep this under 30 minutes. Do we have any questions about the OSMA health insurance plan? Or concerns?
Hey Brandon, John Fuller here at Midtown Pharmacy in Beaver Dam. I was
Hey,
just
John.
gonna let everybody know that we've been doing this for about a year and a half now, and we've been more than pleased. We came from all the Anthem plans, and every year we always had to rebid everything out because the deductibles or the premiums would go up 25% every year. And so far for the last 2 years, this OSMA plan we haven't had to farm anything out because the rates have been pretty competitive, and we've been happy with and our employees have been happy with our plan. So just wanted to appreciate you for bringing that to my attention a couple years ago.
Appreciate it, John. And again, I do want to reiterate that again, this plan's not a solution for everything that's going on within your industry, but it's been another option that we've been able to provide to employers. Because quite frankly, there was one option that we did have with Humana that went away, and this kind of came in simultaneously when they were getting out of the market. So it does at minimum give you another option to look at. That is not just Anthem, United Healthcare. All right. Ben, is there anything that I need to add, or you think that would be prudent to discuss?
Well, I think a couple of questions. So one, you talked about the how deductible plans. Do you all work with employers to help them set up their HSA accounts, or is that part of the OSMA product, or is that something they would do separately?
That would be done separately, and there's different ways that you can handle that. You can go out and get basically a third party HSA administrator, and depending on your situation, you may not, and size, to be quite frank, where you don't want to be paying a PEP or PEPM amount to have someone do something that, quite frankly, is pretty easy to set up as long as you understand how to set it up. So you can either use a vendor, or you could go directly to a bank that you have a relationship with, because it's setting up a checking account. It's setting up an HSA, and that's just another line item that's coming out on a pre-tax basis that goes into someone's account that is individually owned. The employer doesn't own it, and it's your money that you have forever, and it's not a use it or lose it. You can maintain that as long as you have funds in that HSA account.
I couldn't think of anything else as you were going through there. So again, I appreciate your time today and everybody joining. Info's there on the slide. If anybody needs to reach out to you, they can do that. Of course, if any of our members have questions or anything we can do to help at the association, everybody knows how to get a hold of us here.